Morning, everyone. Welcome to day one of the water stream. I'm Tara McRae, and I'll be your moderator for today. Just a couple of quick housekeeping items. There'll be time to ask questions at the end of the presentation. And today I'd like to introduce our two speakers. This is about Ministry of Health updates. So I've got Janine Russo here from Ministry of Health. Janine Russo has worked in the field of drinking water and water protection for over 25 years. She's had the honor of working for the BC Public Service since 2009. In November 2020, she took on the role of Director of Healthy Community Environments and is grateful to work with a highly talented and dedicated team of science and policy specialists. Her education includes a Bachelor of Science in Biology and a Master of Science in Geography. Next is Trish Sturloff, Ministry of Health. Trish Sturloff joined the Ministry of Health as the Acting Executive Director of the Health Protection Branch in September of 2020. Trish has been with the provincial government since 2003 and has held positions in a number of ministries, including Transportation and Infrastructure, Olympic Games Secretariat, Jobs, Tourism and Skills Training, the BC Public Service Agency, and the Environmental Assessment Office. Trish has a Bachelor of Business Administration from George Washington University and an MBA from the University of Victoria in Entrepreneurship. Thank you. So over to you, Janine and Trish.
Thank you so much. And we are sad not to be able to be there in person, but hopefully our presentation today will answer some questions. So I am going to share my screen. Okay. Apologies, I'm clearly new on the tech here. Right. Okay, great. So we'll get started. First, I would like to just acknowledge with gratitude that I am presenting today to you from the traditional territories of the Lekwungen people, known today as the Esquimalt and Songhees First Nations, as well as the Métis Charter Community of Victoria. So just really quickly, the overview of our presentation today, we'd love to share a little bit about who we are, talk about our source to tap approach to the protection of drinking water, and then get into a little bit of the legislation and regulation that guides our work, talking about the authorities and responsibilities under the Drinking Water Protection Act, the requirements under the regulation, and then talk a little bit about the communication process and how we're working with EOCP and the health authorities, talking about the customer relationship management tool with EOCP and resources that are available. So as Tara mentioned, I have been with the Ministry of Health in the Health Protection branch for just about a year now. I'm also now the acting executive lead for the overall division for population and public health. And our mission is to promote community environmental health, prevent disease, protect people from harm, and create resilient communities. And obviously, the work that all of you do contributes very significantly to that. Our responsibilities in my division that pertain to drinking water protection, as I mentioned, both include the Drinking Water Protection Act as well as the Drinking Water Protection Regulations. And just a little bit around how we're set up, because I do find that health is a bit unique in government. We are responsible at the ministry itself for development of any legislation or regulations, policy and guidance to ensure that appropriate, cost-effective and timely health services are available for all British Columbians. And in terms of drinking water protection specifically, we administer the Act and the regulation. We develop guidelines that facilitate that implementation. And when and if any changes are needed to the Act or the regulations themselves, that is what my team is responsible for. We also work very closely with Dr. Bonnie Henry's office. So the Office of the Provincial Health Officer is an independent body that has responsibility and oversight for reporting both on the general health of the population, but very specifically in this instance around how the health of the population is being protected under the Drinking Water Protection Act and the regulations, and how we're implementing that. Dr. Henry is also responsible under this to provide independent advice to ministers as well as public health officials on any public health issues that arise from this. And then finally, oh, I'm sorry.
I'm going to jump in, Trish. I've been sent a note that no one can see your slide deck. So I think, you've been doing a great job describing everything. So if it doesn't work, we can certainly continue that way.
Let me see if I can change this. Sorry about that. Very helpful to know. Thank you.
Oh, great. Looks like we're starting to see it now, Trish. Thank you.
Great.
Except it's on, it's not on presentation mode, so you might want to.
Yes, it's just lagging behind me.
Okay, great.
Let's see. Can you see the full screen?
Looks great. Yep.
Okay, perfect. Let me just turn off the subtitles. All right, you can see the full screen.
Yes.
Wonderful. Thank you very much, Janine. Sorry about that, everyone. And so, as I was saying, the Ministry of Health and the Provincial Health Officer both work with all of the health authorities. And there are 5 regional health authorities plus the First Nations Health Authority. And they all also have responsibility around the protection of drinking water, as you all know, and probably deal with the health authorities on a fairly regular basis. They are autonomous and they govern, plan, and deliver healthcare services within their geographic areas. And of course, when it comes to environmental health and the protection of water and drinking water in particular, they have several responsibilities from licensing to testing and monitoring. And the First Nations Health Authority represents a new relationship between BC First Nations, the province of British Columbia, and the government of Canada. And the Health Authority aims to improve outcomes for First Nations people in British Columbia. Just one note about that, when it comes to protection of drinking water on reserve lands, that is federal jurisdiction typically, but we do try to work with and coordinate with the federal government on that.
Great, thanks, Trish. And it looks like I'm getting a few more questions saying that although I can see your slide deck, it looks like people in the audience are unable to see the slide. They can just see the speaking notes.
Oh, okay. Let me see.
So while Trish, how about if we do this? While Trish takes a look at how to change that, maybe I'll jump into the source to tap approach, which I know that probably all of you in the audience today are very familiar with the source to tap approach, but it's something just to remind us because it's foundational to how we develop our policies and legislation and guidelines. And so, as you know, any source of drinking water it's so important to ensure that that drinking water is kept clean and safe for people that are drinking it. It does a number of things. It reduces our costs to treatment. And of course, as you all know, way better than I do, I'm sure that the treatment is really, the treatment must be suitable to the drinking water source that you're using for any consumption of drinking water. So it's really important. And so from a Minister of Health point of view, we do a lot of work with our partner ministries to ensure that we have that they have policies and guidelines that are in alignment with the Drinking Water Protection Act and regulation. And I'll just stop there. Trish, it looks like you've got it perfectly. I don't see any other follow-up notes. It sounds like we're on track here.
Great.
And is there anything you'd like to add, Trish, with the slides that you've presented so far?
Nope, I think that's good. Thanks so much, Janine.
Awesome. Okay, so we'll jump on to the next slide. And as Trish mentioned, we're going to talk a little bit about an overview of our, excuse me, our Act and regulations. So the most important pieces of legislation that we have is, of course, the Drinking Water Protection Act and the Drinking Water Protection Regulation. Many of you probably know about the Drinking Water Officers Guide, which is essentially the guidance that facilitates the implementation of the Act and regulation. And it's obviously, by its title, it's written for drinking water officers so that they have guidance to implement all the acts or all the Act and the regulation that supports this. Thank you, Trish. Trish mentioned an overview of the Ministry of Health's responsibilities, but I'll just like to go through that again with you. So overall, the ministry has accountability for the administration of the Act and the regulation. So any changes to the Act and regulation are held within this office. We also develop any technical work, such as, I think you probably are, many of you are familiar with rainwater harvesting guidelines, for example, and we'll talk a little bit about new technical guidelines that will be coming out in the near future. We also support any policy guidance that's needed to support the Drinking Water Protection Act and regulation. And again, as I mentioned, most of that is with the drinking water officer as the intended audience, but that information is really valuable for anyone that is operating a water system or has any involvement in the delivery of safe drinking water. And we also provide coordination with drinking water officers, with the health authorities. And one of the main governance bodies that does that is the Drinking Water Leadership Council. And the Drinking Water Leadership Council meets on a bi-monthly basis. And participating in that are drinking water officers, regional managers in the health authorities, First Nation health authorities, an important partner with us, the Ministry of Environment, and other provincial ministries also joins this call to ensure that we're sharing information that's really relevant to protecting drinking water sources, for example, but also, as I mentioned earlier, on just the delivery of drinking water in general. I think operators, it's probably, you'd be interested in knowing that the Municipal Affairs Ministry is an important partner in the Drinking Water Leadership Council as well. Thank you, Trish. The Provincial Health Office and the Provincial Health Officer, they play a crucial role in the delivery of safe drinking water as well. And they're named in the Act, in the Drinking Water Protection Act. So for example, the Provincial Health Officer provides advice on the qualifications of the drinking water officer. The PHO also can review a decision by the drinking water officer and oversees ensuring that drinking water officers implement or enforce the Act and the regulation, and ensures that they're following the guidance of the Drinking Water Officers Guide, for example. And that's really not surprising. We tend to have these checks and balances with acts and regulations, and so that's an important role that that office plays. The Provincial Health Officer also produces an annual report. You've probably all seen many of those. It's the progress on the action plan for safe drinking water is often the title. The Public Health Officer also has powers under the Public Health Act, as well as the Drinking Water Protection Act, to ensure that if any impediments to public health are observed, that they would have action to follow up on that. Another area is with respect to drinking water protection plans. So if the Provincial Health Officer feels that a specific area is in need of an overall watershed plan, which we're calling a drinking water protection plan, that the Provincial Health Officer can make that recommendation to the Minister under our Act. Thank you, Trish. The regional health authorities. So by no means do two small bullets suggest that they have a smaller role. These are the frontline people that are implementing the Act and the regulation, or I should say, supporting the enforcement of it. with water suppliers and operators. They play such an important role, and they're the first face between the water system operators and the Act. So it's really important that they, you probably have all met them, and many of them, and they really are the crucial link here. There's a progressive enforcement model that's used in British Columbia, and that tends to be the model for any public health act. So what that means is there's a continuum ensuring that there's awareness of the Act and regulation, there's education of the Act and regulation. And when I speak to drinking water officers, what they'll often tell me is they have what's most important is developing relationships with operators and supporting how the Act and regulation are implemented. So it's really a partnership that they see needing to be developed in order to support that implementation of the Act and regulation. We also have public health engineers that also play a crucial role in this as well. Thank you, Trish. So I think I've mentioned this already. Education and awareness is really key, and there's a progressive compliance and enforcement approach. Some of the things that you'll be aware of is operating permits and conditions on permits that will be placed by a drinking water officer. Officers also have a really wide range of discretionary abilities to require, for example, a source assessment. So water sources need to be assessed all the time, I believe, when they're first permitted, but there could be ongoing assessments that are needed, and other protection measures. And like I said earlier, the drinking water officers are the first, sort of on the ground implementing the Act and regulations. So they would have discretion to understand your system and to help you put barriers in place to ensure that drinking water for your consumers is safe. Thank you, Trish. And of course, implementing the Act. So who better that needs to be discussed than the owners and operators? Because as you all know, the Act and regulation in British Columbia really puts the onus on the operators and owners to ensure that what you provide to your customers is potable, so that it's safe according to our Act and regulation. As you know, systems serving more than 500 individuals must have operators certified through the EOCP. Thank you, Kim. That's a great idea about the questions. And we'll also take some questions at the end. You're probably all aware that the EOCP is named in our regulation under Section 12. And so they have such an important role in classifying water systems and also certification of water system operators. And so I talked about checks and balances, and this is really an important piece of how we ensure that those that are at the front lines of delivering safe drinking water have the proper accreditation. Thank you, Trish. So we have a fairly, I think, innovative way of helping with the awareness and education component of the progressive enforcement approach. Health authorities are responsible for implementing the Act and regulation, as I mentioned, and EOCP has really played a really helpful role in the last, I don't actually know how long, but sort of in the near future or near past, in helping us understand how, or not us as the ministry, but the health authorities and operators, ensuring that you've met some of the regulatory requirements and met them through an awareness and education approach, which I think is really helpful, because as you all would agree, I'm sure, is that, access to safe drinking water is really in the public interest. And so we really need to promote what we see as education and awareness to help all of you meet the requirements of the Act and regulation. And so this has really promoted what we think is collaboration and trust building amongst the drinking water community. And I think it's a really innovative approach. So EOCP works with owners and operators through this approach, through this communication process, to identify and address any outstanding issues. Next slide, Trish, please. And so what is this process and what is this communication approach? EOCP uses their customer relationship manager to help all of us understand where we're at in achieving compliance with the Act and regulation. So it could be simple things like, have you submitted your paperwork, for example, to ensure that you're up to date on your accreditation? It's really helpful because I think everybody is very busy with the work that you do. And so this is a nice way to just remind people of where things are at. And it also opens up a communication process between water system operators, public health engineers, or the drinking water officers. And it really, I think, supports that awareness component of progressive compliance and enforcement. The CRM is accessible to the Ministry of Health, to the Public Health Office, health authorities, drinking water officers, but it's also available to many of you as operators, persons in charge of systems. And as I mentioned, it provides information on drinking water facilities, operator information, like where you're at with your accreditation, for example, any learning units that you need to add. And it's really tailored to specific needs of the operator. And as I understand, there's enhanced data security and enhanced access to, or limitations on access. And it also helps in case of events of emergencies, which is, I understand, has been very helpful in the event of fires recently.
Maybe just to jump in, Janine, I think one of the points we're trying to make too is that the relationship the ministry has with EOCP is strong and something that we actually rely on. So we rely on EOCP to be so connected to all of you as members and to surface issues or concerns, and they do so directly with myself and my staff so that we can address things in a timely manner. And as Janine mentioned, also goes the other way around where, during wildfire season, we heard from EOCP right away with questions on how they could help assist and how they could help the province in response. And so it's a really strong relationship that is built on communication and trust. And this CRM is just one of the ways that we're able to achieve that.
Great, thank you, Trish. So I think there was a question that I missed around, and maybe I'll stop there. How do small water systems fit into this? Thank you for that question. And I think it links to an earlier question about, let's see, why the 500 peoples for classification? I think that's the question. Yeah, so that's how the, the Act has defined a water system and a small water system. So it falls out of the definition in our Act. Having said that, it's certainly been identified that that is something that needs attention, is classification of systems under 500. So it's been raised. I know EOCP has done some preliminary work on that. And as Trish mentioned, that's something that we're talking about with them all the time as issues that are raised. And I think this is certainly an issue that we're aware of. But I think that if that's the question, I hope I've answered it. It really falls out of our legislation at the moment. Agreed. Yes, and that has come up several times. Small water systems are a very complex issue, and they do need attention. And it's one of our main areas of focus right now is looking at small water systems and how to improve that. So we have I think many of you might know of some of the work that we're doing on small water systems. So is a small water system less than 500? It's not quite that simple, but it's close. Let me grab the definition here. I believe it's 500 people and there's a time period attached to it. So I'll look that up, and I'll just sorry, I'm just following this. I'll look that up as I'll finish this slide, and then I'll look up that question because Trish might do some filling in for me while I do that. Do you need a small system ticket to operate one if you have a higher ticket? I'm going to take that question away. It'd be so great to be in the room with everybody. I have such a great team, as I mentioned earlier in my introduction, so they're all sending me answers. They're awesome. A small system means a water supply system that serves up to 500 individuals during any 24-hour period. That's from Alistair. Thank you so much, Alistair, one of the stars on the team. So I hope that answers that question. You're welcome. Trish, do you mind going back one slide, please, if you don't mind? I'm not sure if I finished with that. I did. Okay, great. Thank you. On to the next one. So a few things that are I hope I think I answered any questions. If there's any one that I missed, please let me know. I seem to not be able to see all the questions. So some of the things that we're working on right now, or that you might, sorry, this is what is already available. So Drinking Water Officer's Guide I talked about. Guidance for treatment of rainwater harvesting for potable water. That seems to be a very popular item these days, especially during the last summer with the drought that's going on. And of course, the online CRM reference manager has been super helpful. Some things in the near future, thank you, Trish. I just had a note from Alistair, and Sabrina Dearmert are also are also working on some, along with, I know a number of you out in the industry as well as the health authorities have worked on some technical guidelines, one for pathogen log reduction, one for ultraviolet disinfection, and of course the top one, system design guidelines for systems in general. And we're targeting the fall of 2021, so very shortly. And let me just read this. It would be nice because I have a full water treatment plant, but okay, got that. Thank you, Danielle. This is with respect to small water systems again. So in the spring, we're hoping to see an emergency response and contingency plan guidance document, which will, I think, be very helpful. And again, during the wildfire season, that's come up a number of times. And we'll be, you can view these on EOCP's website. That's where we put them for wider distribution. And I believe you may be even getting a shout out from Kelpna on some of these documents as well. Next slide. And so, yeah, that's it. And we can take some questions. And I see one from Roland. Are the fall guideline changes to pathogens and UV disinfection? Oops, I missed that. Going to adjust existing treatment classifications? I cannot answer that question at the moment, but I will take that one away as well, Roland. Alistair is sending me an answer right now. He says it's an excellent question, and classification is based on treatment already in place. No changes expected. Great, thank you. Yeah, the team has really reached out to a lot of industries and organizations, you know, especially, of course, the health authorities and public health engineers, and they've gotten a lot of feedback on the guidance, and we've had a lot of really positive feedback. So I think early indication is that it's very, very much been something that people have anticipated and been wanting. So I'm hoping that it'll be out shortly for everyone to have a look at. Great.
Any other questions? It is a large silent room. Okay. Well, I think then what we will do is we'll be happy to wrap up here and give you a few minutes before your next session. Just wanted to sincerely thank Kalpna and the rest of the EOCP team for inviting us today and having us present. Certainly, it's our hope that we continue to connect with operators on the ground and learn more about how our policy decisions and regulatory environment either help or hinder the work that you're doing so that we can continue to increase our game and raise our game all the time for the protection of drinking water for British Columbians. So thank you very much for having us today.
Thank you, Trish, and thanks everyone, and thanks for your comments here. And I just want to reiterate what Trish has said. So at the end of the presentation, there's an email. I know this is not the best way to present and have those really important discussions that we need to have, like small water systems. So please reach out through the email. Happy to answer any questions we have. And yeah, we really appreciate your perspectives on this. Thank you.
Okay, thanks Janine and Trish for your presentation. That was great. Just a reminder to some folks that that are listening in that we have opportunities for prizes. There's some presenters will be providing opportunities to win prizes. There's also be social media posts where you can enter draws. And then we're asking the participants to please complete surveys at the end of day 1 and day 2. And the type of prizes that are up for grabs will be movie passes and water or wastewater t-shirts, just to mention a couple of them. So thanks again, Janine and Trish. That was an interesting presentation. Thank you.
Thank you.